Hello, back again. How is it going? This is Real Health Talk with Dr. Coring. And for those who do not know me, my name is Dr. Coring. I am now a board certified internal medicine physician, as well as a pharmacist by training and trade, and also in fellowship, learning how to be an hematologist and oncologist. And it is my passion and pleasure, as well as desire, to educate common folks such as yourself on various health topics to improve wellness as well as to improve health literacy, overall to improve good outcomes. And that's why I started this channel. I am passionate about patient education. And today I have a question for you guys. Do you currently have resistant hypertension? Meaning, do you take at least 3 blood pressure medications? One of those medications a diuretic? Meaning, are those one of those medications hydrochlorothiazide and/or chlorthalidone and/or indapamide? The reason why I ask this question is because if you have resistant hypertension, meaning you take at least 3 blood pressure medications, so you're taking 3 different blood pressure medications, while one of those medications, so one out of the 3 medications are a diuretic. We call these diuretics, or this particular one I'm referring to is a thiazide type diuretic. The most common thiazide type diuretic is hydrochlorothiazide, but there are more. Chlorthalidone, I mentioned that, and dopamine, I mentioned that. So the question is, if you have resistant hypertension, meaning you take at least three antihypertensives, and then the next question is, are you getting good sleep? And if the answer is yes, I take at least 3 different blood pressure medications. So maybe you have resistant hypertension. So if yes to that question. However, if no to the second question, are you not getting good sleep, or are you getting good sleep? And if the answer is no, I'm not getting good sleep, Dr. Coring, then I want to warn you, you may have something called obstructive sleep apnea, or OSA. All right. It turns out that about 85% of patients with resistant hypertension, meaning you take at least 3 different antihypertensives, were diagnosed with obstructive sleep apnea. Okay. And so that brings me to this topic today, that people with resistant hypertension are at risk or may have obstructive sleep apnea, which can improve your high blood pressure if treated adequately for the obstructive sleep apnea. Okay? And so I want to talk today about obstructive sleep apnea. You know, obstructive sleep apnea, and from now on, I'm going to say OSA, it's the most common sleep disorder. People with OSA repeatedly stop breathing in their sleep. That's how this disease manifests. Basically, apneic breathing, or just essentially you stop breathing periodically in your sleep. That's what's scary about this. And why does this happen? Well, it typically is because the throat muscles relax and blocks the airways, causing obstructive sleep apnea, or OSA. So what are the signs and symptoms? What are the symptoms of this? Well, people with this typically have daytime sleepiness. So throughout the day at work, they just taking naps all throughout the day. They just dozing off, taking naps, loud snoring. You know, I ask the spouse and or the partner of the patient, hey, have you noticed, your partner or your spouse, snoring loud? Do they snore in their sleep? And some people you don't even have to ask. They know they snore. They wake up snoring. And so in the snoring is what wake them up. So they could tell you, yeah, Dr. Coring, my spouse or my wife or whomever said that I do snore loud, even to the point where they have to sleep in another room. So I get that a lot. Have you observed, or have someone observe you not breathing in your sleep? Like, have somebody say, hey, wake up. Oh, what's going on? Man, you weren't breathing. Pausing during your sleep. It could be scary witnessing that. And so that's another symptom. Trouble focusing. You know, throughout the day, you have trouble staying on task or focusing. That could be a symptom of OSA. Have how's your sex life? I mean, we know that OSA can cause a decreased libido. So sex haven't been important for me, doc. I've normally, it's been like on the forefront of my mind, but for the past X amount of months, just haven't been, important. It's not that you have erectile dysfunction. It's not that you can't get an erection. You just haven't been thinking about it. You're not up for it, for example. Moodiness, irritability, depression. All of these are symptoms of sleep apnea or obstructive sleep apnea. And then lastly, hypertension. And we already discussed that. But yeah, hypertension, can be also a symptom of OSA. And so that's why I want to bring this to you guys' attention. If you're on 3 different blood pressure medications and your blood pressure is still not controlled, maybe it's time for you to tell your doctor, hey, doc, maybe I should get screened for OSA or obstructive sleep apnea. I heard Dr. Corin talk about this on Real Health Talk with Dr. Corin. So what are the risk factors? Why or what puts somebody at risk for OSA? The main risk factor, especially here in the US of A, obesity. Having that fat around your neck, that can cause obstruction, decrease airway into the lungs, and cause sleep apnea. So lose the weight, that could help you, and also reduce the blood pressure. Another risk factor, smoking. All right, diabetes. Being a man, men are 2 to 3 times more likely to have OSA. So that put you at risk just by being a man. All right. And so it brings me to the next topic, or the next point I want to make is, how do we treat obstructive sleep apnea? But wait, let's take a step back. Before we talk about treatment, how do we diagnose it? All right. So let's say you come to my clinic. I see you. You say, doc, I'm on 3 different blood pressure medications. I'm taking naps at work. I'm not making love to my lady how I used to. She all over me. I'm just not up for it. She say I snore loud. She's sleeping in another room anyway. I got to lose this weight. I'm a little bit obese. I'm going to be like, look, man, I think you got OSA. Let's go ahead and get you to take a polysomnogram. What is that? That's just a sleep study. What do? They basically hook you up to these monitors, and they have pulmonologists to look at your sleep patterns, look at your waves, the sleep waves, and to see how many times you're waking up in the middle of the night and how many times your breathing stops in the middle of the night or while you're sleeping. And they also looking at your oxygen saturations to see if your lungs are getting enough oxygen also while you're sleeping. And they use all of this data, all of this information to make the diagnosis. And once the diagnosis is made, okay, you have OSA, obstructive sleep apnea, based on this sleep study. Then what do we do? I'm glad you asked. The standard of care right now is continuous positive airway pressure, CPAP. I'm sure I'm sure most of you are aware that a CPAP is a machine that basically is connected with tubing. With that tubing, it's a mask at the end of that tube. You put that mask on, and that machine have a pump that continuously pump basically oxygen into your lungs while you sleep, forcing oxygen into your lungs while you sleep to overcome those pauses or those apneic episodes. All right? And so basically I wanted to use this time and this opportunity to maybe bring to your attention as a patient, caregiver, spouse, whomever, that if you know somebody or you yourself are on 3 different blood pressure medications, one of them being a thiazide diuretic, and you also not sleeping well at night, then you may want to ask your primary care provider to screen you or consider screening you for OSA. Why is that important? Well, OSA can cause problems. And if it's not diagnosed, then OSA can lead to cardiovascular issues, one being high blood pressure, another one being atrial fibrillation, another one being heart failure, and that can lead to death or bad outcomes. And so it's very important that we get screened for OSA if indicated. And one of the indications is resistant hypertension, meaning you take at least 3 different antihypertensives to control your blood pressure, and even that may not be enough. I think it may be time for you to get screened for OSA. That's my time, folks. I love you guys. Like and subscribe. Leave some comments. Let me know what you're thinking. Would love to understand it. All right. Love you. Peace. Bye.